Lab values. Okay, about to tell you everything you need to know about lab values for the NCLEX. And this is going to be something that you can also use when you're out on the unit working as a nurse, and something that's pretty helpful. So you always want to know the lab values about your patient, anything that's out of range, but some of them are more important than others. Now, just like anything on the NCLEX, what is the most important thing for you to know about lab values? It's that you need to know the labs that every other new graduate RN knows. You don't have to know every one of them. You just have to know what everybody else knows. Okay, that's what's going to help you pass the NCLEX, is knowing what other new graduate nurses know. There's a big concept I want to start off with on lab values. What you need to do is make sure that when you're looking at a lab value, you have to consider how toxic that substance is to the body. There's some things that may be way out of range, but if that substance on its own is not toxic to the body, then you're not going to place a huge emphasis on that value. So, for example, say we used creatinine, okay? Creatinine is an indicator of renal function. And if somebody has a creatinine that's way out of range, that's 5 or 6 times the normal lab value, yeah, that's going to indicate that your kidneys are jacked up, but you're not going to die of a high creatinine, right? That substance alone is not toxic to you. It's an indicator that something is wrong, and yeah, you've got a problem, but that's not a super critical thing. It's something you can monitor over time to see how the kidneys are functioning. But if you have a potassium level that's just a little bit out of range, you can start to see some really wacky stuff. So you're never going to see a potassium that's twice the normal limit. That patient would have no heartbeat at all. Like it would totally have stopped the heart already. So not compatible with life. So you need to put a much higher priority on something like potassium because it's got a much narrower tolerance, and that substance in its own is very toxic to the body. Okay, so that's a huge concept to consider. What we want to do is we want to rank different lab values into 4 different categories. I'm going to break these down into A level labs, B level labs, C's, and D's. Now, A stands for abnormal. All right, the significance of an A lab is that it's abnormal and you're not going to do anything. All right, these are acceptable labs. A means abnormal and acceptable. Something we're just going to watch, but we don't need to do anything about them. B means that you need to beware. These are borderline labs. B equals beware and borderline. So we're going to assess this patient, and we're going to monitor for changes over time. But it's not something that you need to jump on or need to page the physician about necessarily. C level labs. C means critical. These are labs that are out of range, and you're going to need to do something very soon. You don't need to, you don't need to jump on this, but this is something that you need to do something about. It's going to be a priority part of your day. And then D, these are deadly or dangerous labs. So you need to do something right now. These are things that you stop everything that you're doing and you go assess them. So when you have a potassium that's 6.5, that's considered a D level lab. Okay, that's something that you need to go do something about right now. I'm going to break down potassium here in a little bit, but deadly labs require immediate intervention. All right, so for pH, normal pH range 7.35 to 7.45. If you have a pH in the 6s, that's a D level priority lab. All right. Anything slightly out of range, so like a 7.3, 7.29, those are out of range, but they're not as huge of a priority. But when that pH gets down in the 6s, you need to get vital signs right now, and you need to call the doctor or call a code based off of your patient's experience. Now, potassium. Normal lab value for potassium is 3.5 to 5.3. Some will say 5.0, some will say 5.1, but on the NCLEX, you can go 3.5 to 5.3. So the D level lab for potassium is anything over 6. All right. You need to, if you get a lab value of potassium in the 6s, you need to prepare to give calcium gluconate, and that's if the EKG indicates. All right. Now, this brings up a good point. You always want to treat the patient and what they're experiencing right now, and not the lab value or not what the monitor says or their vital signs say. So, for example, I got a call from the lab one day that one of my patients had a potassium level in the 7s. And so obviously that's something you need to jump on right away. We said D-level labs mean they're deadly or dangerous and that you need to do something now. So I had potassium in the 7s. So I go straight to that patient's room. I open the door, look at the patient. They look up at me and smile. And I say, "How you feeling?" And the patient says, "I'm feeling good." So my first thought is, if this patient is still alert and oriented with the potassium in the 7s, that's kind of odd. This patient seemed totally normal. So I went over and I assessed their heart rate, because your potassium level is inversely related to heart rate. So if your potassium goes up, heart rate goes down. Now, heart rate was just fine. So my first thought is, okay, something happened with this lab. It was contaminated. And so we redrew the potassium level. I kept my eye on that patient, and the potassium level was normal. So something happened. It got contaminated the first time around. And so had I gone in there and just started some intervention on that patient who, wasn't experiencing anything out of the ordinary, I would have looked like a wacko. So always treat the patient and what they're experiencing, not what, you feel like you should be doing or what the lab value indicates, right? Always treat the patient, not the monitor. So if the potassium is over 6, we want to watch that cardiac rhythm, prepare to give calcium gluconate. If it's 5.4 to 5.9, so it's elevated, but not over into the 6s, you're going to hold any kind of potassium if it's running. That's the first thing you do. Then you're going to assess their heart. Okay, because remember, their heart rate is inversely related to the potassium level. So high potassium, low heart rate. We're going to want to prepare to infuse D5W with regular insulin. And then we're going to call the doctor. Right. Now, we're not going to give the D5W with regular insulin until we get the order for it, but that's what we're going to anticipate doing. D5W with the regular insulin. Now you're going to have that dextrose in the bloodstream with the insulin. The insulin acts like a key, remember? So when insulin opens up the cells, insulin is a storage hormone. That's essentially all it does in the body. It's open up cells for storage. And that dextrose that's in the bloodstream is going to go into that cell. And the other thing that's going to go with it, though, is some potassium. So now you got potassium in your body's cells, and it reduces the potassium that's in the bloodstream and affecting your heart. So the potassium's in the cells. It's not going to stay there forever, though. So you're going to want to keep monitoring this. You've essentially just shoved everything underneath the bed. Yeah, your room looks clean, but all that crap's still under there. So you're still going to have to deal with it at some point. So you're going to keep your eye on it. Now, if the patient has a low potassium, that's a C-level lab, just like a high potassium that's between 5.4 and 5.9 is a C-level lab. These are critical labs, and you're going to need to do something, but it's not a deadly situation. So if the potassium's low, you're going to want to assess their heart. And the second thing you want to do is prepare to infuse some potassium. Might be PO, might be IV. And the other thing you're going to do is call the doctor. So CO2 level, and this is a CO2 level that you're going to get from an ABG, from an arterial blood gas. Now, one thing I want you to consider first is, does this patient have COPD? Right? Because if this patient has COPD, then this lab value is essentially useless, because they have all sorts of compensatory mechanisms that their body's adapted to help them deal with their COPD, and their CO2 level is just going to be totally out of whack. So don't put too much value on this if a patient has COPD. But a normal CO2 level on an ABG should be 35 to 45. So what happens if you get a lab value back and it's in the 60s, so 60% or more? Well, this is essentially respiratory failure. This is a patient who's retaining a lot of CO2. So the first thing you're going to do is assess their respiratory status. And this is a D level lab in the 60s. Okay, is assess the respiratory status. The second thing you want to do pursed lip breathing, and then you want to prepare to intubate. Because again, this is respiratory failure. This is a bad situation in a normal person who does not have COPD. And the other thing you want to do is call respiratory and then the doctor. Now, a lot of facilities, you call it code, respiratory, and the doctor are coming. So calling a code would be a great thing to do as the final step. So, and you look at these, you want to assess, do, prepare, and then call. Right? Now, say it's elevated above 35 to 45 normal range, but it's just into the 50s. This is a C-level lab. It's critical, but it's not like having somebody in the 60s who's in total respiratory failure. So you're going to want to assess their respiratory status. And then you want to have the patient hyperventilate with pursed lips. So that hyperventilation is going to cause that person to blow off more hydrogen as they're exhaling and get rid of some of that acid in their body. So next on to PO2. Now, again, this is from an ABG. This is not the value that you're getting in the pulse oximeter that you hook up to the patient's finger or their earlobe or whatever. This is something from an arterial blood gas. So respiratory, most likely, unless you're working in a critical care environment and you have an A line on a patient. This is something that's coming from respiratory. They're drawing this, and normal lab value for PO2 is 78 to 100. And there's a D level lab value for the partial pressure of oxygen, and that deadly level lab value is 60 and below. So the first thing you want to do if you get a lab value under 60 for PO2 is to assess the respiratory status. That's the first thing. Second thing, you want to put some oxygen on them, right? And then you want to prepare to intubate this patient. And the last thing is call the respiratory therapist and then the doctor. Again, if you call a code, you're going to get both of those people. All right, so assess them, throw some O2 on them, call the code and get ready to intubate them. All right, and you may need to start intubating before calling respiratory. So you start bagging this patient, hit the call light, and call the code. There's a critical lab value, which is if it's a low O2, this is anything between 70 and 77. Okay, so you're going to want to assess the respiratory status and give O2. On to platelets. Platelets is another lab value where there is a deadly level, a D level lab value. Normal platelet level is 150,000 to 400,000. So pretty broad range, but the D level lab for platelets is anything below 40,000. And the first thing that you want to do is assess for bleeding. And, platelets are a clotting factor that you need to have in your blood. So if it's low, you're prone to bleeding. So first thing you want to do is assess for bleeding, because you can call the doctor, but what are they going to ask you? Well, are they bleeding from everywhere? They're getting people kind of, blood coming out of their mouth, their rectum, all over the place. These are people that you go to give them their heparin shot, and the heparin shot just doesn't stop bleeding. This blood just keeps coming out of their abdomen, or you put insulin in their arm, and the blood just keeps coming out, never clots. And you're going to prepare to transfuse platelets for a patient with a platelet level below 40,000. Now, there's a C-level lab value, a critical lab value, and this is for patients who are between 40,000 and 90,000. And I work on a unit every now and then that's a hematology oncology unit, a hemonc unit. And in hemonc, you have patients with really low platelet levels fairly regularly. So, this is something that we expect to see from them, but we're going to want to watch their bleeding and have them on bleeding precautions also. All right. So these are patients on bleeding precautions, which is also called thrombocytopenic precautions. These are patients where we're going to try and want to avoid any kind of venipuncture if possible. Fortunately in HEMONC, most of the patients, because they're getting chemo and a lot of other drugs and having labs drawn frequently, they're going to have a PICC line, some sort of central line, so we can avoid sticking them as much as possible. But we also want to handle these patients gently. We want to use the draw sheet, not be pushing and pulling. These are patients that should be using an electric razor at home, not shaving with a safety razor. We want to make sure that these patients aren't playing contact sports, that they are using a really super soft toothbrush, making sure that they don't have bleeding gums. We don't want to give them anything rectally. There's no aspirin or anticoagulants that they should be getting in addition. We want to make sure that they're not running around with bare feet. We want to make sure that their clothes aren't too tight and that they're using stool softeners so that they don't have to strain when they're going to have a bowel movement. Because that's a place that they can start to lose blood, but they may not notice it right away. And then want to let them know that they need to call the doctor if they start to see blood in their stool or in their urine. So again, 40,000 to 90,000, that's a critical lab value, but it's not necessarily deadly. It's something we want to watch. Now, INR has a critical lab value, and INR is used to monitor the Coumadin level of a patient. Coumadin is also called warfarin, and they're not going to necessarily give you both names on the NCLEX. They might say Coumadin, they might say warfarin. And the therapeutic level for Coumadin is 2 to 3. Right. If it's below that, then they have a higher likelihood of clotting. And if it's too high, if it's above 3, then they have a potential to bleed too much. So the critical lab value is if it's over 4. If it's over 4, we're obviously going to hold that drug, and we're not going to give it to them. We're going to call the doctor. But after holding, we're going to assess for bleeding, see if they've got blood anywhere, and then we're going to prepare to administer the antidote to Coumadin, which is vitamin K. Right? And then we're going to call the doctor, let him know the findings of the bleeding, and find out what it is they want to do. Most likely, we're going to want to give them some vitamin K. So that's a critical lab value. It's a C. For white blood cells, WBCs. Now, this is monitoring your immune function, and they could give you this lab value for white blood cells in a couple different ways. One, they might ask you the total white blood cells, which normal value is between 5,000 and 11,000. They could ask you the ANC, which is the absolute neutrophil count, which should be over 500. Or they could ask you or indicate the CD4 count. And those are your T lymphocytes, and anything under 200 is associated with AIDS. So if it's over 200, they just have HIV. If it's below 200, they actually have AIDS. So these patients are highly immunocompromised. So these are patients who are on neutropenic precautions, which are also called reverse precautions. They may say they're on protective cautions. They may say leukopenic or bone marrow precautions. So these are patients need to have strict hand washing for the caregivers, for family members, for the patient. They need to shower twice a day. They're going to use antimicrobial soap. They need to avoid crowds. When they do go out, it's not a bad idea for them to wear a mask. These are patients you want to assign to a private room, limit their visitors to healthy people, so usually like no little kids. These are patients you don't want to have any flowers or potted plants in the room. They're going to be on a low bacteria diet, so no fresh fruits and vegetables, no yogurt, nothing that's going to have any kind of bacteria in it. You're going to be checking their vitals Q4 most likely, especially the temperature, because you want to monitor for any sign of infection, because these are people, again, who are immunocompromised. You're going to need to jump on that temperature right away because they don't have a natural immune system fighting any kind of infection. You want to use anything disposable that's possible. So disposable plates, silverware, cups, that kind of stuff. This isn't a situation where you want to leave a cup in a patient's room for 3 days and let them keep drinking out of it. You want to change that stuff out. So you want to give them dedicated items like their own blood pressure cuff, things that you need for assessments. If they can put their own stethoscope in the room, it's another great thing. And then most likely their physicians are going to be monitoring, and you're going to want to be monitoring their white blood cells and their counts daily. So a lot of times you'll see these patients, in hem-onc I see these a lot. So because of the chemotherapy, you wipe out their immune system. So you're going to see that they're on medications. They're going to be taking an antifungal, they're going to be taking an antiviral, and they're going to be taking an antibacterial or an antibiotic. So that's it for WBCs. Those are all C-level lab values. Stuff you want to monitor, but on their own, they're not bad. But when you start throwing other things in with these C-level labs, that's when it becomes a serious problem. Now, O2 saturation. This is not the O2 saturation from an ABG. This is what you're actually seeing it on the patient's finger probe or on their earlobe. So you'll see monitor O2 saturation on the forehead. Normal lab value 93 to 100. Now one of the things we'll see when we're sending a patient home and they're going to be on home O2, Medicaid won't even cover them unless their O2 sat on ambulation is below 88%. So, in real life, if things drop a little bit, it's not that bad, especially if the patient normally has a low O2 level. So, just a couple days ago, I had a patient who their baseline O2 level is 90%. Especially COPD patients, you're going to see this all the time. Now, the critical lab value on O2 sat is anything under 93. So you're going to want to assess their respiratory status and give them some O2. COPD patients, you don't really want to go over 2% without, other indication from the physician. But, throw some O2 on them and you're going to monitor that patient, see how their O2 saturation responds, and then contact the doctor, if indicated. Sodium level, normal level is 135 to 145. And this is, if it's out of that range, it's just abnormal. It's just a B-level lab, unless the patient has a change in level of consciousness. So if the change in LOC is present, then it's going to be a critical lab value. You're going to want to do something about that. Hemoglobin, 12 to 18. If the hemoglobin is under 8, that's a critical lab value. You're probably going to end up, transfusing some blood for that patient. And if it's between 8 and 11, that's a B-level lab. You're going to monitor it. Most likely they're not going to treat that, but under 8, most likely it's going to be treated with some blood. Unless again, those hem-onc patients, they may routinely run around with a hemoglobin of 7. And if it's under that, you're going to give, a unit or two of packed red blood cells. But, that's part of what we expect from those patients is to have a low hemoglobin. BUN, 8 to 30, BUN, 8 to 30. So if the BUN's elevated, you're going to check for dehydration, right? And if they're dehydrated, obviously you're going to give them some fluids. That's a B-level lab. It's something that's borderline, something that we want to beware of, but it's not critical. RBC should be between 4 and 6 million. And if the RBCs are low, you're going to want to assess for bleeding. And that's a B-level lab. BMP, and that's an indicator of congestive heart failure. So normal lab value is anything under 100. So if it's over 100, that's a B-level lab. Yeah, if it comes back and it's 225, is that bad? Yes, because it means that they're in heart failure. But they're not going to die of a BMP being high. They might die of heart failure, but the BMP, chemical, that peptide on its own is not deadly to the body. It's just an indicator. So that's what we were talking about before about, consider how deadly is a substance to a patient's body. not what does that indicate. Right? Now, creatinine, 0.6 to 1.2. And if it's elevated, that's an A-level lab. It's abnormal. Going to want to monitor it, but not a big deal. Bicarb, 22 to 26. Anything out of range is abnormal. That's an A-level lab value. So in summary to these lab values, there's a couple things I want you to consider. The first thing that we mentioned straight off was, I want you to consider how toxic a particular substance is to the patient's body. And remember, A, lab values are abnormal, so you're not going to do anything, but you're going to want to watch them. B, lab values, you're going to want to beware and assess and monitor for changes. C, are critical, so you need to do something very soon. D stands for deadly or dangerous, so you're going to want to do something right now. Now, there's one thing I want you to notice about this. There are 5 D-level labs, okay? They are pH in the 6s, right? Potassium over 6, CO2 level in the 60s or above. You have a PO2 level of 60 or below, and then platelets below 40,000. So what do you notice off those right off the bat, right? pH 6, potassium 6, CO2 60, PO2 60, and then the outlier. So see all the 6s showing up, all right? And then a platelets below 40,000. That's the kind of the wacky one. So those are your D-level labs, right? There's 5 of those. So study those first. Yeah, we just went over a bunch of labs, but can you memorize 5 of them? Those are the ones that if you don't recognize that they're out of range on the NCLEX, you miss those. Those are, things that every other new grad knows. So you ought to know those. Then what you got to do is learn what to do for the C-level labs. And there's only a handful of those too, right? So there's a couple for potassium, high and low potassium, CO2 being in the 50s, PO2 below 77, and platelets between 40,000 and 90,000, and INR over 4, and there's just a couple others, WBCs, O2 sat, sodium, and hemoglobin. All right, so first study the 5 Ds, then learn what to do for all the Cs. Everything else is a low priority. So if you only study those handful that we just talked about, the Cs and the Ds, you don't have to worry about the As and the Bs. If those show up on your exam, just ignore them. If it doesn't show up on your radar as being something that's bizarre and way out of range, just ignore it. It's not important. Focus on the items that are way out of range, and you're going to do well. And that wraps up what we have for lab values.